Welcome to NewYorkBIO's Virtual Breakfast Series, a digital program started in 2020 featuring fireside chats with leaders from across the healthcare spectrum. This week's episode features Lukas Furtenbach, the founder, owner, and operator of Furtenbach Adventures.
All right. Good morning, everyone. My name is Jennifer Hawks-Bland, and I'm the CEO at NewYorkBIO. We're thrilled you're here with us for another edition of our virtual breakfast series. We are doing something a little different today, and a special thanks to our partners at Woodruff Sawyer for not only sponsoring this month's series of breakfast, but also recommending Lukas to us as a leadership discussion topic for today. So as always, please ask your questions for Lukas in either the Q&A or the chat box on the Zoom website. And Derek and I will get to them as we go through the conversation with him. With that, how can I almost forget? We are 2 weeks away from our annual meeting. So please, if you haven't already, register. We have both virtual and in-person options for you. For attendance, we'll be meeting in person down in the financial district in Manhattan. And obviously for virtual, you can be anywhere in the world, including Europe, where our guest joins us, I think, today. So with that, I will turn it over to Derek and we'll get into our conversation with Lukas. Thanks, everybody.
Fantastic. Thanks, Jennifer. So Lukas, it's great to have you. And a very big thank you to Megan Rath for putting us in touch with you. And so usually we start with an origin story from our guest, although a lot of the times it talks a little bit about, the areas of science that they got into, where they did their PhD and how their career kind of morphed in the sciences. Occasionally people will have maybe one story about, say, shrimp fishing, fly fishing in Canada, being marooned on a desert island. However, your background includes all of those things and more. So why don't you give our guests a little bit of a sense of how you got to where you are, and also an overview of what Furtenbach Adventures focuses on.
Okay, welcome everyone. Thank you for having me. I was growing up in Austria, Europe, and I started climbing when I was a kid at 3 years old. So I was skiing and climbing my whole life. When I was 18 and when I finished school, I wanted to see the world. So I stranded on an island in Belize, where I found a job for international concierge service. They were hosting companies from all around the world and offering concierge services to their clients. This was my time when I experienced for the first time that for many people, time is the limiting factor in their life and not money. And this became very important for me and for my own business about 20 years later. After Belize, I went to Canada as a fly fishing guide in a camp that was running management seminars. Another important experience to meet these kind of people with a time limit factor in their life. And then I came home and did my study at university. I'm a geographer and still climbing my whole life. I started to run expeditions, and I realized that this is where I want to make my money, where I want to spend my time. I want to run expeditions. This is what works for me. And that's where I finally landed. I founded the company called Furtenbach Adventures. That's my name, an Austrian name, a German name. We have a branch in the US and Lake Tahoe, but our main office is in Austria. And now we run expeditions all over the world, but our main focus is clearly Everest, K2 in Pakistan. Then we made our program bigger over the years. We added helicopter skiing, we added ski touring, different climbing and adventure trips. This is what we do now. And we try to be innovative. We try to focus on technology. We try to focus on safety. And that's maybe the point that makes us different from other companies in this industry.
Yeah, I find it really interesting that, at some point, a lot of times you figure out that the limiting factor is time, right? All the things that even if you want to see a certain place in the world, if you want to do all these things, the limiting factor is when are you going to do it? right? And in many ways, you can find the resources to do it. You can find the opportunity to do it. You can plan it all out, but figuring out the when is difficult because in a lot of ways, kind of life gets in the way, right? You have other things that are pulling at you. And so what are some of the realizations around that? We can get into a few different angles of things, and we will, but just in general, what are some of your viewpoints on how people think about their time and how people manage it?
Of course, we all spend most of our time for work. Then it's family. And if people have and families, for me, it's the most important thing in life, because the time you miss with your family, with your kids, I have 2 small kids, you never get back. So this is a very important part. And that's why I started to understand my clients. When you have the dream to climb Mount Everest, an Everest expedition takes traditionally 8 to 9 weeks, maybe even 10 weeks. So that's a lot of time for most people, impossible with job, family. So our idea was, how can we make an expedition shorter? Because we want to make this mountain accessible for people with less time. And then we finally ended with technology, but we come to this later. But we could see that we hit the point. As soon as we started to cut the time needed for an expedition to Mount Everest from 9 to 3 weeks, we were sold out immediately for the next year.
How did you, I mean, what was your process though? So a lot of our guests obviously are scientists and they're solving for, new treatments for people. And you were solving for a solution for people probably like us who would like to do this. How did you figure out how to narrow it down?
The problem why an expedition to Mount Everest or to another high mountain takes so long is that your body needs to acclimatize to the low oxygen level in altitude. You're all scientists, so you know the basics probably. Your body needs to build red blood cells. I'm not a medical scientist, so
I'm a lawyer.
I'm telling this very basic, from a basic approach.
Yes.
But we need to build red blood cells. We need to trigger our hypoxic breathing system, and then we need, and that needs time. It needs 4, 5, 6, 7 weeks until our body is ready to climb in this altitude with this low level of oxygen. So the only way you can, there's no shortcuts. Body needs that time. So the only way, without doping or any medical treatment, would be, and we consider this cheating. So the only way would be, there are ways how you can achieve this without climatizing. But as I said, we see this as a form of cheating. The only way is that we move the time of the acclimatization process from the mountain to your home. And we were lucky because the technology was already there. From cyclists, pro cyclists, they were using this as a training, as a part of their training. It's called Hypoxic training system. It's a generator filtering air, surrounding air through a zeolite filter, which is taking out oxygen off the air and blowing reduced oxygen air in a tent where you sleep, or in a mask system where you exercise. And it has, the first scientific studies have been out in beginning of 2001 or 2 with these kind of systems. And it clearly showed that it works about in the same way and with the same efficiency as you would acclimatize in real altitude. And I was lucky to meet one of the scientists, one of the leading scientists in this field in Innsbruck University, Professor Bocha, and I became part of, in one of his studies as a test person. And it was not for climbing, not meant for mountaineering, but I immediately saw the opportunity. Okay, you can use this for mountaineering. And I started to test with my own. He got a system for me. I had it at home, and I just tested. There was no experience with this. Nobody could tell me how much time you have to spend in this tent, in what altitude, in what oxygen level, with what SpO2 in the night, to be ready acclimatized for an expedition. What hematocrit you need to build up during the time you acclimatize. Nobody knew it. So yeah, we just experimented and I tested, and I found out that it works very well for me, which is nothing worse because it's just one person and has no scientific worth. So he made a bigger study with about 20 people, and it showed about the same results. It was very successful. And then that was the point where I said, okay, we can use this commercially. We can use this for our clients on expeditions. And then we started on our first expeditions in Pakistan, where we acclimatized all the clients at home. Everyone got his hypoxic tent set up, tent home. They were sleeping in this setup for 6-7 weeks. And then they could arrive at the destination country in Pakistan, China, or Nepal, basically ready acclimatized, basically ready to climb.
So I have a question, I have a comment, and then we have a question from the audience, which I also had. So one is, this would have been helpful. I this summer climbed a mountain in Utah, but I did it in like 10 hours after landing. And once I got above 10,000 feet, I was like, whoa. So I was like, yeah, clearly I needed a little more time. My husband managed to get up above 11 without, so he clearly had some more red blood cells than I did. And then the question that came in is, with the training, right, with the hypoxic training, how often? Is it 24/7 before you go, or are people sitting with their computers in their tent doing their work during the day? Or is it a certain amount of time per day to really achieve that?
Yeah, it's a certain amount of time during a time period. We say it depends on what you want to, what goal you have. For Everest, for example, we say it's 350 hours within 8 weeks. Most of the time you sleep in the tent. If you sleep 6 or 7 hours per night, then it's easy to reach this 350 hours within 8 weeks. So that's about it. But that shows, if you take the blood work, like testing hematocrit every couple of days, you can see after 3 or 4 weeks hematocrit starting to raise, and after 6 or 7 weeks it's about at the level where it should be when you go to a mountain. So it's very metric, numbers driven. It's provable. And it's no. We could see that it works, and then we finally had our first Everest expedition with this technology, and it was 21 days from home for everyone to the summit of Mount Everest, and this was it was a sensation in the industry. And yeah, next season.
So we were going to do this later, but I think we should keep digging on the data angle, because from the standpoint of the healthcare industry, I think we now have kind of more and more sources of data, and I think people are coming around to the idea that our health should be better quantified, whether we're thinking about biology and finding new targets for new therapies, or simply, day to day, how do you actually think about your health, and how do you put a number on how healthy you are now, even from a longitudinal standpoint. So talk a little bit about how you think about adding technology to expeditions, because it's not a trivial aspect, right? I mean, what you're talking about now is a little bit in preparation, but when you think about an expedition, everything that you add either adds a bit of complexity, it adds weight, it adds another thing to keep track of. So what is your process like for thinking about new kinds of data? And how do you actually either do kind of the pilot testing or whatever to make sure that it's not only good enough for you, but good enough for the rest of the people that are going to be on the expedition?
Good question. So our goal is to make expeditions safer. So every technology out there that could help us make expeditions safer, we try to use, we test, and if it works for us and if it makes our expedition safer, we will implement it in our standard operation. You can simplify everything down on Mount Everest to SpO2 of the climber. As long as SpO2 is above a certain critical level, there's no danger of altitude sickness, haze. Everything will be more or less fine, depending on all the other dangers like avalanches, rockfall, but this is something we can handle as mountain guides. But from a medical point of view, SpO2 is where we have our focus on. And heart rate, of course, as well, but
Yeah.
it's mainly SpO2. So the first thing we did is we started, the idea was why it was a standard to measure SpO2 from every client every morning, every night when they go to bed, and in high camp when they sleep, and document this so that we could see a development of their SpO2 with gaining altitude. But it was not enough, because we knew we would need to know SpO2 while they climb, or on the summit push, on the summit day, on the summit. So the SpO2 devices that we used, they were not giving reliable data when someone was moving. Also the smart watches like Apple Watch and Garmin watches, as soon as you start to move, in cold environment, data is not that reliable anymore. So we finally found one sensor that worked even in movement and even in a cold environment. It's an American company. And then we started to put this sensor in a liner glove that we use inside our thick down mittens.
Right.
Mm-hmm. We made the first tests. Mostly me and my guides are the first people, the primary testers if we have a new idea of technology. We test during an expedition. If we see, okay, basically this works for us, then the next expedition or the next season, we make a bigger test with a bigger group of people testing this, maybe a few clients already. We ask them if they would like to test this. It could be a technology in the future that we will be using as a standard. They would be the first to test this. Always they say, yes, would be great, we would love to test this. And then we have more experiences. We know what we need to change, what we need to make better, what works and what doesn't work. And then in a third season or expedition, we mostly have a final product ready that we can use as a standard for all clients.
Yeah.
Mm-hmm.
And this was with the SpO2 sensor in the glove. The next thing was that we are using oxygen systems when we climb Everest. Special oxygen systems. So we designed a new system that can deliver more oxygen with a higher flow rate. A standard flow rate for Everest was 2 to 4 liters. We found out that for some people, this is not enough. You are very big people or people that have a very high breathing rate. It can't be enough. So first thing we did, we made a bigger reservoir. We made a higher flow rate, like up to 8 liters. And we found that this works great. But we also could see that a 90-pound woman might not have the same need of flow as a 200-pound man. And also depending on what level of training they have and altitude tolerance they have. And breathing rate, there's so many factors.
Yeah.
How fit the mask, how tight the mask is fitting their face. So we saw that we need to individualize and customize the flow rate to every client to be safe. So the only idea was to see, okay, we measure SpO2 during the climb and we set the flow rate depending on SpO2. And that was as easy as it sounds. Nobody had this idea before, and now that's what we do. And as long as we keep everyone above a critical level of SpO2, everyone will be fine.
Yeah. Do you test them in training to know where to set it for each individual?
Yes. We have training rotations on the mountain where everyone can test the system and where we can see where we have to set this level.
Right.
Yeah. It's really funny. I mean, you have basically just described the entire digital health innovation loop. Right? You think about, seriously, you think about the things that you'd like to measure. You're thinking about specific customer requirements. You're thinking about, if we're going to put the lens on, if we're going to equate customers to patients, you're thinking about different patient needs and different health needs too. So this is great, because these are some of the parallels that I thought we would get into. So we'll take a little bit of a turn here, because you've mentioned that you had started doing this yourself. You've been climbing and skiing since you were a toddler, really. But when you go on to lead expeditions, it's not just you, right? You now have other people that probably don't necessarily have the same skills that you do. You get a mix of people that now you're your communication has to be different, your management has to be different. And I wanted to talk a little bit about some of the early experiences you had there. So what was it like, you know, now I don't know how many, you know, hundreds of these that you've done, but if you go back, what were the first few like, and what were some of the big takeaways that you had, either, you know, from kind of the first couple of times that you ever needed to lead a group on something like an Everest expedition with this massive amount of preparation and, you know, all of the things that could happen once you actually got out there?
I found out that maybe I'm good at inspiring people. I'm maybe not the best teacher, but I understand that I can find teachers, I can hire teachers, I can hire guides, mountain guides, that are better teachers than I am. So, but what I found out very early, that I'm good at inspiring and motivating people. And I can implant an idea in someone's head that grows and grows and finally becomes the wish to climb Mount Everest. It's the only logical goal if you come into climbing. And it's what I found out, it's what it's all about. If you lead people through the process from having this idea to finally going on an expedition, signing up on an expedition to Mount Everest, is helping them to push their limits in this process, and also, more important, to believe in their ability to succeed and succeed in a really big goal. And here comes something important with our clients. Most of our clients are people that are used to success and that are used to have success. All of them are very good in something, in their job, in running their business, or even in their sport, if they come from another sport as a professional athlete. So it's not hard I don't need to explain them how you reach goals, how you visualize your success. They know all this. They have this mindset already. But it also helps a lot if I know that they can visualize their success and they start in the whole process there with the goal, I am succeeding, and not I don't know how this ends, if I will reach summit or not, or if I will stand on the top of Everest. No, if I start this, I will climb Mount Everest, and that's it. And that makes it easy for us to work with such people. And the biggest obstacle that most of these clients have is, again, finding time for proper preparation, for the training that is needed for this expedition. And again, this was why we ended with the hypoxic expeditions. We call them flash expeditions because they are so short. And we became very successful with this kind of expeditions, and we could see this was hitting the point from so many people. They don't have the time, so they need to squeeze an expedition in this short time frame. And
do you do you still do traditional ones where they acclimate
yes,
on site? Okay,
sure.
So
because if people have the time, it's nothing against traditional expeditions. If people have time, I even recommend doing the traditional one. It's an experience.
But you're right. If you wait till you retire, you may be past the age of capability of scaling a mountain. But otherwise, you kind of have to wait till you're in between jobs, or you have a sabbatical, something like that, right?
Yeah, right. And then it's
go ahead.
Yeah, sorry.
Keep going.
During an expedition, it's maybe one of the biggest challenges for us, for the guides and for the expedition leader, is to keep the group motivated, even when you have days where not everything is running perfectly smooth. And this demands, or someone has a bad day, and this demands a lot of empathy from the guides and from the expedition leader, especially in hard times. But we try to keep that dream alive, and as young, and it's the whole it's easier for our industry than in your industry, for example, because it's so loaded and charged with feelings, with emotions, the whole outdoor industry. So it's easy to keep a dream alive in a client's mind. And that makes everything easier to keep people motivated.
I'm actually very afraid for my husband to watch this now, that if he knows you can do it, and he's an ice climber, and so we will not tell him this is on YouTube.
Oh no, I'm gonna forward it to him right away. Right away. Yeah, he'll be climbing Everest in December. So I want to stay on the angle of your customers and their growth, right? Because one of the things that we talked a little bit about with Megan in the lead up to this is things like leadership, discipline, decision making, and kind of like you said, in these kind of expeditions, your customers are all flexing different muscles, right, than they usually do. They're and kind of like you said as well, they're used to a level of success in their jobs, and they're used to being proficient and good at things. So, how do you see your activities impacting your clients, right? If you kind of think about your clients before and you think about the journey that they go through and you think about them afterwards, what are some of kind of the major things that you see, either, changes, growth, learnings, etc.?
They all come back with a bigger ego, for sure. And that's okay. That's totally okay.
Is that the point?
Justified at that point, right?
Want to be teaching people?
They climbed Everest, the highest mountain in the world.
Yeah.
It's okay to have a big ego after that.
Yeah, I guess so.
As you said, it's a process. And I guess some of you have kids. Kids need routines that are the same every day, like standard protocols. And that makes them feel safe and secure. They also need this to perform better in school or in sport, in their own development. But most importantly, they need this in a crisis or in an extreme situation. And an expedition is an extreme situation, extreme environment, extreme danger. You can die every day, possibly.
Right.
In countries that are very, very dangerous, Pakistan, Nepal. And so kids always need to feel that you as a father or mother know exactly what you're doing and why you are doing this and what will come next and what we have to do if something goes wrong. No matter if you really know, but you have to give them this feeling and that confidence that you're following routines, whatever comes. And clients on expeditions are about the same. They need routines. I can tell you about one experience I had 2018, Everest expedition. It shows that also we try to bring new technology and innovation to a rather conservative business. A modern fail-forward culture wouldn't work in our business, and that's important because it would mean that people die in our
the whole fast fail concept really shouldn't be in Everest expeditions.
No room for mistake. No, so so imagine being 300 meters below the summit of Mount Everest, 1,000 feet. Very summit nights, very cold and windy night. This is the so-called death zone, so you can't survive without an oxygen system for more than like 24 hours. And it's the night of the summit push. And you as a client, you get one single shot for the summit. If you fail, next chance, you have to wait 1 year. You have to pay again $100,000, $200,000. And imagine you are there with a group of climbers, and you as a guide are responsible for them. And they all have family home. And everyone is paying a lot of money to you so that you take the right decisions about their safety. We try to use the latest and best oxygen system available. And the oxygen system is absolutely necessary. Without it, you die. And other teams in the same night as well on the mountain using the same oxygen system and suddenly the oxygen system starts to fail. You can imagine from diving, if your breathing system fails, it's pretty bad.
Because you're at what, like 28,000 feet here?
Yeah.
Yes.
Yeah.
2008, this is a real story. 2018, short before the summit. Oxygen system failed with all teams at the same time. Crazy noises, they seem to blow up. The cylinders lose all the oxygen within seconds. So panic. Panic from the clients, panic from the guides. Some teams have all their systems failing, and some teams only 40–50% of their systems. Nobody knows what's going on. This never happened before. Nobody knows what's going on. Total chaos. Other teams start to panic. Sherpas, the ones that are helping us carrying all the stuff, and the guides are rushing to somehow bring the clients down in safety, where we have new oxygen bottles, and everybody knows the season is over for them. And already from high camp, some of the clients from other teams that have to cancel the expedition because of the failing oxygen system, already from high camps are calling their lawyers home to sue the company, the operator, because they are the ones to blame because they failed on their summit attempt. So also the guides from other companies, from other operators, managed the situation very well, and nobody died in this night. Everyone came down safe, and everyone was trained for a situation like this, and it's nothing happened, but still they could not summit, and their clients taking legal actions, and it's a big mess. In our team, in this night, everyone stayed calm when this happened, but we were hit as well. So what we did, we took our spare oxygen equipment, we changed regulators, masks, and cylinders, because we carry spares for everyone as a standard procedure. And then we proceeded and climbed to the summit and back. And we have been the only team on the summit in this night with this failing oxygen system. All clients summited, and all clients came back safe to base camp. And we did not handle the situation better than anyone else, because the others did a great job to bring down everyone alive. But the only difference was our guys, even our guides, they have the same level of qualification, the same standard of certification, the same training. Just one little point that made a difference. No other team was carrying spare equipment. And this is a critical piece of equipment. If it fails, you die. So why would you not take spares with you? And carrying extra oxygen equipment for every client and guide has always been a standard protocol in our operation. And every client knew this, so they did not panic. And we have done this for years. And in 2018, it saved us from a catastrophe. So in mountaineering, as well as also in business, you never know what critical situation is around the corner, and you can't be prepared for every single extreme situation, because there are so many possibilities that what could go wrong. But
you have to build in redundancies.
Right, acting according a protocol gives confidence to the team, to the customer, to the guide. It's that simple. For us, it was that simple, the solution. Having protocols, having standard procedures, and having routines, the same what kids need.
And do you work with your clients and your customers to make sure they have the training? Clearly, they have a lot of mental stamina and physical stamina if they're undertaking it in the beginning. But do you work with them on like crisis expectations on the mountain and how that is different?
Yes, because almost all of our clients on Everest, they join us on other expeditions, training expeditions, smaller mountains, lower mountains, where we can train exactly these things. Okay. And then they are basically perfectly prepared for Everest when we say, now you're ready to go Everest.
Yeah. So can you talk a little, I thought your story was going to go in a different direction, right? Because I thought that, you know, one of the things that I was thinking about is how do you actually deal with either, you know, bad news, setbacks, or anything? I think everyone has probably some parallel either from their career or from their life where they had to deal with something like that. Obviously, in a situation like this, it's a little more pointed, right? Because, like you said, there's much more risk involved. So, can you talk about any sort of times where you've kind of where you had to handle a difficult situation like that, where you've had to actually either, tell people that they're going to be disappointed, you tell people they're not going to be able to summit, even whether it's from an injury or anything like that. Can you talk a little bit about what that's like and how you approach it?
The most difficult situation in my career as an expedition operator and mountain guide was this Everest season during the pandemic. It was a long process of decision making if we will be running an expedition this spring season on Everest or not. Finally, we relied on promises from the Nepalese government to have safety protocols. We made our own safety protocols. We sent our own team doctor with test kits and all this stuff. And we came together with our clients, we came to the decision to run an expedition, like many others. We came to base camp, everyone triple tested and everyone clean. We kept all our team isolated and we tried to make everything right, as good as you can do it in this place and this part of the world.
Yeah.
Of course, it's not a clinical environment, but we did what we could. And then a massive wave of infections hit Nepal, coming from India, right at the time when the expedition season started. And next thing was we could expect this already. First cases in base camp popped up. And then within 2 or 3 weeks, it was a massive outbreak in base camp. When we had the first cases in our team, we did standard testing every day. After we did our first rotation on the mountain, this was the first time we had contact to another team, an Indian team. Next day, we tested one of our clients positive. We did a double test, again positive.
Yeah.
We went out with a helicopter, and we knew, okay, that's it. Even so, other operators had no intention of canceling the season or the expedition. Also, the Nepalese government, first was a call I made was the tourism department in Nepal to cancel the season because we have a massive outbreak in base camp and it would be irresponsible to let this season go on. They said, no, there's no evidence for any cases in base camp. Okay, I can rely on them. So we said together with our expedition doctor, all the guides and me, and we decided, okay, even if we test people negative here, 3 or 4 days later in high camp, they become positive, become symptomatic, and that's it. Somebody can die. We are fully liable because we knew we had an outbreak in base camp, so we can't send people up. For us, it was a very logical decision. So 1 hour later, we called all the clients together. We told them our decision to cancel the expedition. We can't just do it. It's too. Some people understood. Some people said, oh, I take the risk for me. I said, you can take it for you, but I can take the risk for my guide and for the Sherpa that is climbing for you. I'm an employer here. I have to take care about them. So most people understood, but this was the most difficult decision because you can imagine not only some of the clients were very upset with this decision, also other expedition operators were very upset with our expeditions because we have been the first operator to openly speak about, yes, there's an outbreak in base camp. And next step was that the government was very upset with our decision and about our way of communicating this to media. But still, at the end, it was the right decision. And now all the other people, our clients from other operators are coming to us and saying, okay, next expedition with you because you managed this so well.
Yeah.
Right.
So, did the Nepalese have, did they have access to vaccines at that point?
No, at that point not, and that was the problem.
Okay.
No Sherpa was vaccinated. Very few clients have been vaccinated. Now everyone is vaccinated. Every Sherpa, every guide, every client, and now we are safe to run it. We feel safe to run expeditions again. But At that time, not possible.
It was just too early in the vaccine rollout process for them to have been vaccinated. Yeah.
And it was also the first time for me to admit that, yes, this was a wrong assessment of the situation. We shouldn't have run the expedition. It was a mistake. It was a wrong assessment of the whole situation.
Yeah. But it was changing so quick. I mean, it was changing so quickly at that point, right?
Yeah. But we never, and that's not marketing, we never had a critical situation on the mountain, but that's what we sell. We sell safety on the mountain.
Yeah.
We never had, in 20 years, we never had an accident on the mountain.
Lukas, what are the, just for people that don't know, what are the general dates for the season? I know it obviously changes slightly each year, but generally speaking, what is the climbing season for Everest?
The window is very short. It's April, May. This is the only season where you climb Everest.
Yeah. In other mountains, you have longer to climb, or does it?
Yes, you have other mountains of the 8,000 meter range in Pakistan that you climb in summer, and then lower ones in Nepal that you climb in the autumn season, but that's more or less the window.
Yeah.
So I think this is a good opportunity to think about kind of growth and team building, right? Because you started with you, and now you have other people around you, and you mentioned a bit before how you thought about your skills as a motivator and being able to add teachers, being able to add people that kind of filled in around your skill sets. You know, how do you think about this now? Because you've gone from mountaineering, and you look on the website, you have heli skiing, you have all of these other activities. How do you think about growth in that respect, and the kind of, I'll say, different experiences that they bring to it, right? It's a little bit different. I imagine a heli skiing expedition is different to prepare for and different to think about than an Everest expedition.
Yes, that's totally true. At the beginning, it was a simple business decision, because we didn't want to be so dependent from two destinations, Pakistan and Nepal. Both very critical, unstable destinations. We didn't want to be so dependent from one single season. And of course, we can hook up a wider range of clients with this idea of climbing and having adventure out there with other activities that have maybe a lower entry barrier, like skiing, helicopter skiing, ski touring, even mountain bike trips. And mountain guides with this IFMTA qualification, they are educated to teach both skiing and climbing. So it makes sense to combine these. And even some of the destinations that we operate, they offer perfect terrain to combine both activities. You do ice climbing, even in Canada, you do ice climbing, and next day you go helicopter skiing. So it fits perfectly together. And also, in people that have a passion for outdoor sports, they like both. So it was a logical step to offer the whole range of outdoor sports. For the team building in our own team and organization in the company, it was, again, I think, easier than in another industry, because we attract people that love what we sell and that have this as a passion, what we sell. So it's also easy to have them motivated. And
they're self-selecting.
Yes. And the only job I have to do is to fit the right person for the right position, and then it's easy. And what I do is I try to give everyone not only the feeling, it is true. I tell everyone, and everyone understands and lives this, that he's the one why this whole operation runs smooth. And without him, or her, it wouldn't work. And this is, everyone in our organization has the same importance. If it's the kitchen helper in the base camp, or if it's the mountain guide on the summit day, everyone is important that everything runs smoothly. And yeah, my experience is that team building, keeping the team motivated is much easier in our industry than in other industries. But it also means that there's no place for ego. Ego is the client side. We are the team. And in an ideal world, we are all a team together with our clients. And most of the time it works.
It is funny that you mentioned the ego on the client side. So I wonder if so you've been doing this for, I think, 20 years now. And I wonder if you see, I would say, patterns in the clients that you get, right? Do you how good is your radar for what someone is like, in the beginning of the trip and either the transformation or the things that they go to? Are you pretty well tuned to how you think things are going to go on the client side, or are there still people that surprise you?
Yeah, that's maybe a very important point. We expect a very high level of discipline from our customers. It's necessary to survive. And they like being pushed. So people that sign up for these kind of trips, they are highly motivated, and they also respond well to clear directions. But sometimes we have people, as you say, with too big egos. Some clients are these type A personalities, driven by ego, need for independence. And then it's our job to find ways to give them their room to go in front. Often pairing them with a similar aggressive Sherpa. We are always pairing a client with a Sherpa, and we can fit these together, personalities. Of course, the goal should not be to somehow damp down these people's intensity. Instead, we try to play to their strengths, to make sure that they can bring their strengths, their intensity as a benefit to the group, to the team.
Right. It's probably as much, that part of your job is as much psychological, right,
Yes,
as it is
absolutely.
physical.
Absolutely, yes.
Do you have people that sign up as family groups, or are most of your clients like individuals versus like a couple doing it together, or a parent child, adult child?
Very few couples. Most of them are individuals, but we often have a combination like mother and daughter, or father and son. This happens quite often. Yeah.
My husband and I joke when we play tennis that we're team divorce. So, so I could see that dynamic working or not working, depending on the couple.
Yes, yes.
I actually had a side bet with myself as to whether you would sign up the family to go on an expedition by the end of this call, Jennifer. So we have 11 minutes left. Lukas, just for your edification, I think you probably still have some room to close this client if you work on it by the end of by the end of the discussion.
Yeah, I think we start with diving in Papua New Guinea before we.
On a more kind of pointed note, there, you said before that like you have the ability to, I suppose, make people, kind of motivate people to go and do this, right? And I guess try and either, when you think about it, do you think about the angle that this is something that they're missing, this is something that they need to do? Do you focus on whether they're going to feel better afterwards? Because you're, like you said, you're talking to kind of a high achieving group, right? So if I'm uber successful, if I've achieved all of these things in my life, hypothetically, how do you approach that from a client perspective? Where's the big motivation that you can kind of tap into to have people say, yeah, I think I need to go do this?
When people contact me or our company, they often have this idea already of climbing Everest. So I don't need to give them this idea and the reason why they should climb Everest. Everyone has their own reason why to climb Everest. But then my job is to give them the confidence that there's a way, because often there are people without any climbing experience. So of course they can't just sign up and we take them up Everest. It doesn't work like that.
Yeah, no,
Yes.
It's too dangerous for them and for us. And we want to keep our success rate high. That's what we sell. So, but then it's about giving them a vision. This would be the road to Everest. This would be the schedule. And then the first reaction of these people is, no, it's too long. I don't have this time. I want to do this next year, not in 5 years. And then that's the difficult part, to explain these people that there's no shortcut. You can take the shortcut, but it's dangerous. Yeah.
So you bring up a good point, like that you can't do it next year. So if I came to you today and said, Lukas, I want to climb Everest, what kind of time frame is realistic to do all the work and to do it the right way? Is it 3 years out?
It totally depends where you are. So we would have a long talk with you about your physical condition, about your training routines, about your last 10 years of doing endurance sports and your climbing experience. And then we set up a plan, and it all depends on how much commitment you can give. And commitment means time and money. If you have 1 year off because it's a sabbatical, we often have this situation with New York investment bankers.
Yeah.
So they get 6 months off or 1 year off. Money is no problem. So 1 year off, money no problem. Then we can say, okay, we can get you in shape in 1 year to climb Everest next season. But it
that's their job.
A lot of commitment.
Yeah.
And there's no much room for anything else in this year. But I would say for a standard preparation time is something between 2 and 4 years. And then you are ready, and then you feel ready to climb Everest, and you feel confident to go there. Yeah.
We've
got about.
Actually,
go ahead,
go
Jennifer.
ahead. No, I was just going to we have a question that came in earlier that I actually, I think it's instructive. It's back to the preparation and using the technology, right? And the question is, should we all sleep in basically oxygen deprivation tents in order for, if you're an athlete, a runner, or whatever? Does it also reduce stress on the body, and does it make you more, I guess, not productive, but does your body operate better if you're using this sort of process?
It has both positive and negative impacts on the body if you use it. Positive impacts are your heart rate is a little bit higher, so you burn energy. You lose weight when you sleep in the tent, so it's the only passive workout if you want. But on the other hand, it adds stress to your body.
Because your body is seeking its normal oxygen level, but it's not available.
Exactly. But after this period of sleeping in the tent, you will feel better and you perform better. And then that's proven scientific. So a lot of professional athletes are now using this system. Cyclists, runners, all these endurance sports are using them.
Well, if you've ever had the opportunity to be at altitude, even in the US for a week or 2 weeks, and then when you come back to sea level, you feel like you have more energy, and that's the natural process, right?
That's the same effect.
Yep. So we have a few minutes left, and I thought a good way to wrap up would be with either a story of either you, a teammate, or a client about just kind of one of the better stories of personal growth that you've seen through your activities here, because you think about all of the things that you do. I think in a lot of ways these type of experiences can be transformative, both from an emotional standpoint, a mental standpoint, etc. And they can almost be therapeutic in a way. So I wonder if there's a good story to kind of close on from anywhere in your expeditioning career that you think is a great way to wrap up.
We had in 2017 a blind climber in our team. He was totally blind, 100% blind from his birth. He started climbing when he was 40, totally blind. but he had this idea. He wants to climb.
Yeah.
So a long process, and of course, somewhere he ended up with the idea of climbing the highest mountain, and he approached me if we would accept him as a client. And at first I said, it doesn't work. So he said, go climbing with me and I will show you how I climb. And then you can decide if you take him to Everest. And that's what I did. And I went on a ski tour with him. So you skin up with the touring skis on a mountain, climbed at the last pitches to the top, and you climb down to your ski, and then you ski down off-piste terrain. So it's difficult. Most people, it's very difficult.
Yeah.
Even for blind person, it's even more difficult. So he had his team of 2 guides that are friends that he was climbing with for many years, and I was totally impressed how this works. And I had no idea that this could work at all. After that day, I said, okay, you join our team for Everest. And then he came to Everest with us 2017. And the rest of the team was not all of them were happy about this, because I could understand them, because they were fearing that he will slow down the whole team. Right. He could be a danger to the success of the team. But I tried to tell them, no, it will be fine. He's okay. And at the end, he was one of the fastest in the team, one of the best performing in the team. And he summited and came down and was the first person to summit Mount Everest from the north side in China. There was an American blind climber from the south side before him, but he was the second blind climber on Everest and the first from the more difficult north side. So this was for me the most impressive story from someone coming to climbing with really, really a difficult preconditions and then succeeding on Everest.
Yeah. Well, that's terrific. I mean, this has been great. You know, we talk a lot on these episodes with folks who are either CEOs or trying to lead things in healthcare. And you know, we thought there were so many parallels to what you do and to how we try and think about things that this would be great. And certainly this didn't disappoint. This was exceptional. So thank you so much for joining us today. I hope you have a great season this year. And you know, I hope that Megan, we want to wish you good luck. And just to everybody, thank you so much for joining us. Lukas, thank you.
Thanks,
thank you.
Lukas.
This was terrific.
My pleasure. Thank you for having me.
All right. Bye, everyone.
Have a great day, everyone.
Have a good day. Bye-bye.
Thank you for tuning in to NewYorkBIO's virtual breakfast series. Join us every Tuesday at 9 a.m. for more discussions with leaders from across the healthcare spectrum. For more information on NewYorkBIO, please visit us at www.newyorkbio.org.